Thank you, Dr. Manish and Sahani sir. Good evening, good afternoon, and good morning. This is the 1630th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Paul Joseph, professor from Canada. Let us begin the session with 1 minute silent prayer.
Thank you. आपने इस प्लेटफॉर्म को शेयर करने का मौका दिया.
Thank you all. As you all know, the International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. And from 8:30 to 9:30, we have the international session in English from 9:30 to 10:30, a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again, and you can subscribe the same without paying any money. You can share it with your friends, and not only with the doctors and students, but also with homeopathic lovers. The purpose of this forum is to take homeopathy to each and every home around the world and connecting between doctors and homeopathic students around the world. And today, we have a wonderful guest in Professor Dr. Paul Joseph. He has completed his BHMS and R.Hom Homeopathy and PG Diploma in Acupuncture, presently practicing in Canada and at Toronto, Canada. He's the former professor homeopathic medical colleges under Tamil Nadu MGR, Dr. MGR Medical University, India. He is an author and a writer of various medical articles and published 2 Tamil books on health and that's poems. He is a radio host doing talk shows on health and politics in Gidavani for the last 15 years, doing talk show on health and TED TV for the 10 years in Canada. And he has presented some of the most brilliant presentation in this forum. And today, Doctor will be presenting a different topic, unleash the healing artist inside the patient. That we know that some people say there is no medicine required. The patient will heal if the doctor have a very good communication with the patient. Let us see what Dr. Paul Joseph has to say in all this. We proudly welcome you to this session.
Good morning, good evening, good afternoon, everywhere, all over the world. Really, I'm thankful to IFPH, especially the organizers who always contact me, Dr. Danesh, to deliver the lectures in various topics in homeopathy. So here today, I'm going to present Unleash the Healing Artist Inside the Patient. So before that, this is the morning situation in Canada, in Toronto. You can see. So morning around 6 o'clock, I wake up and I did this work because we have to clean every day in front of our home, house, and clinic, right? That is an order from the government because if it is not clean, they'll give the ticket.
Mm-hmm.
So outside the temperature is minus 16 now. So see, yeah, the morning I did. Okay. So now we'll come to the presentation. I think most of you think about what he is going to talk about. This is a homeopathic subject or some other spiritual or some other topic. No. So I'm going to present only one case today and the case related discussion. The patient, she came on December 11th, the last year. It's about 2 months ago. 40 years female patient. The sudden partial loss of vision for 1 month, 1 month duration. Very blurred. He explained the double vision comes on and off. Pupil moderately dilated when I examined the patient. She had a history of stroke 6 months ago, and immediately he admitted in the hospital in the emergency department, and she recovered. There is no symptom at all now. So mild stroke 2 times she had. So even though in the 40 years old, she is a known case of diabetic and as well as hypertension. So she is taking medication for a long time. I think it's 4 to 5 years of period. So along with this partial loss of vision, she had a headache, especially in the occipital region, and the numbness over there on the occipital region, and sometimes it may extend to the neck and upper part of the shoulder, upper part of the back. So it's a short story of the patient, because I had a full history of maybe around 2-3 pages of history. Just narrated in few words and few lines. Sleeplessness, very dull, and always drowsiness like that, right? She always, even in front of me, she always like that, sleepy mood and right, very drowsy in nature. So while taking the history, her husband was beside. So he's also very cooperative, and he explained a lot of things about her mental symptoms, worries always, anticipation, anxiety. The history of emotional shock, it's about past 1 year, then on and off. I'll tell you what happened. Worried about huge financial investment. They invested in different things, especially in movie industry. They did a huge financial investment in movie industry. So these kind of things. So very painful. Sorry, the ordeal. What is ordeal? I'll explain later what is ordeal. The bad news. Why always sees little afraid of bad news always? That is called anticipation anxiety, right? Because they invested huge money. We don't know what's going to happen in that money and whether we are getting back or not. So these kind of things are always thinking, and even though they had a good experience in the past, right? And this time they invest money in South Indian movie industry. So that's why they are a little worried about that. And I always asking about sensation. What kind of feeling, what kind of sensation you have, right, in the vision, in front of your vision, and all, while looking the objects and all. So she explained, she feels smoke, always the smoke comes in front of, right, smokes, kind of cloud over in front of eyes, and cloud shade the sometime outlines of the objects, those kind of things. The diminution of vision, especially he explained this terminology. When you look at the X-ray kind of film, right? So that kind of feeling I always have. So she explained in his way of language. So everything I have written over here. So finally they diagnosed. That is a very interesting. So when he came to me, when she came to me and she came with a report. So even I have the bunch of report with me. They diagnosed in Western medicine, conventional medicine, they diagnosed hemianopia. Hemianopia. Some people, they pronounce hemianopsia, so like that. So this is the very interesting case. Even I didn't know about even before about this diagnosis. So then I went into the literature and all these things. But we need the most right totality of symptoms. Even this hemianopia mentioned in various repertory, right? When I looked into the various repertory, it mentioned about that. Even for, I think most of you may heard about this problem. For some of you, maybe it's a new terminology. So that through this diagnosis, what is that? So they diagnosed as a homonymous hemianopsia or hemianopia. Some textbook they mention about homeopsia, like that. So what is it actually? The loss of vision in the half field of each eye. So you can see the picture. Loss of vision, the half field of each eye, maybe in left side or right side. So left side hemianopsia, the upper one, the picture. The right side hemianopia, they say left side one. So the lower, the picture I mentioned, the below. So in a lot of their literature, they mention about this may happen even in brain tumor, stroke, and different kind of brain injury, so like that. See? When I searched the Manchester University literature, so they describe about all these things. Hemianopsia, whatever you can call it in different, right? Is where there is a loss of 1/2 of our vision field. Hemianopia is caused by a damage to the brain, for example, by stroke, trauma, tumor, and maybe it extend of the field of field loss that can be very depend upon the area where the brain, which part of the brain is involved. So like that they explain in. So you can see when the patient look at the objects, you can see the normal one and the abnormal one. Now, what is the pathology behind this hemianopsia? So mainly the optic nerve involved. Optic nerve, I think all of you know, it's a second cranial nerve. The optic nerve transmit all visual information, including brightness perception, color perceptions, and contrast, visual acuity. It also conduct the visual impulses that are responsible for two important neurological reflexes like light reflex and also its accommodation reflex. So these things I think many of you know, we studied in anatomy and physiology, right? And the second one, the optic chiasma. This is the primary function. The primary function of chiasma is to allow the registration of the memory of each visual hemifield on the contralateral side. You know the physiology, right? And the other important organs, the important the lateral geniculate nucleus it is located in thalamus. right? That's called thalamic nucleus. It's defined as the relay station. That's a very important organ. Thalamus, you know, is the relay station of all the sensation comes and goes inside and outside the brain. So here the LGN, that is a lateral geniculate nucleus, right, is responsible for efficiently transmitting signals in linear fashion to central visual system for processing information related to the shape, color, the motion, and other visual functions. So that's why it's very important part. Why I'm explaining all? Because the pathology behind this hemianopia, now you can see, so where the problem actually, right? So there's a infarction because of stroke, infarction happen in the lateral geniculate nucleus, LGN. You can see the picture over here, small infarction where the optic nerve, right, enter that part. So you can see the why it's how it's happened when the patient look the seeing the objects. So this is the normal one, the below one, the upper one, the half of the field completely lost. So again, the anatomy, right? I think most of you are familiar with the anatomy, how the visual field, the optic nerves and all these things, right? Just for your remember, I'm explaining all these things. And the other things, there's a little complication, right, to understand in the what's actually it's happened while the visions or the visual pathway, right? You can see the different arteries are involved, right? Anterior cerebral artery and internal carotid artery and posterior communicating artery. But here in this picture, the anterior, this artery, the anterior cerebral artery, that is more involved over here in case of hemianopia. So here also the visual pathway of neuroanatomy. And so what's happened usually when the hemianopia happened? A person may experience in variety of symptoms which can be mild or severe. It's depend upon the area of infarctions, right? So sometimes some of these symptoms, it's very difficulty in seeing objects. The side of the vision may disturb. Bumping into the obstacle. Sometimes the patient, when she passed through the hurdles and even walking through the steps, that's also very difficult. And double blurred vision, distoriated vision. Then the visual hallucination, such as the light flash or some shock flash like that, right? Then the other symptoms, difficulty in seeing color. There's the problem in not color, completely color blindness, but difficulty in identifying the color. Then the loss of depth of perception, right? So the distance of the object, very difficult to count or very difficult to understand to the depth and the distance of the objects where it is actually. And very difficulty in moving in the crowd, and reading difficulty. It's usually happen because the half of the vision field is completely lost. So there are symptoms as like that. So patient is really suffering more than 1 month, right? So what are the causes usually, right? The most common trusted causes is a stroke. So this patient had a stroke because there's according to the MRI, the infarction is there in the nucleus. Then the other causes also, brain trauma, injury, then tumors, bleeding due to accidents or trauma, some kind of infections, even in case of epilepsy also. Then MS, in case of MS, patient may have. Then Alzheimer's disease, dementia, so aneurysm, even in chronic case of migraine, patient may have this kind of thing. The similar disease that is called amblyopia. What is amblyopia? That's also similar, but in the pathology may little differ. But in most of the repertories and most of the materia medica, they mention about this diagnosis is similar to the hemianopia. Yeah. So after the full history, complete study of the patient, I repertorized. The gelsemium came. I think many of you know this is one of the important remedy, right? Gelsemium came, and as usual, I used to usually refer to the Supreme Court after repertorization. We don't prescribe the remedy, right, immediately, but we referred to the different kind of materia medica as a Supreme Court of appeal, we call. So in Boric materia medica, so he mentioned about vision, illusion of diplopia, double vision. So gelsemium is there. Vision, dim, blurred. Again, the gelsemium is there. And vision, paralysis of optic nerve. But here there is no paralysis, but it seems to be because already the infarction, though infarction may cause the paralysis, right, of optic nerve, and gelsemium also is there. So like that. And I refer the other materia medica, Clark materia medica. So here you can see in Clark materia medica, Clark mentioned about gelsemium, eye, double vision, controllable by the strength of all will, strength of the will, or when looking sideways. But here, one of the symptom patient mentioned, when she look in sideways like this, so you can see little objects. So this kind of symptom, the Clark mentioned. And Kent materia medica in gelsemium, there are many disturbance of vision, double visions, dim visions, dimness of visions, appearance of gas before the eye, like a cloudy and right, this kind of the objects before the eye. So confusion of vision and blindness. And he mentioned here the field of vision appear full of black spots, right? Completely black spots, like she mentioned in the history, seeing through the X-ray like that, right? And full of smoke, so like that. Oh, just I referred little research papers on in Google, but actually in the gelsemium. What is a toxicological, because materia medica, right? That's a toxicological literature, right? So yes, I went into the research, some of the research papers. So they did all studies, what especially in the ingredient of, see here you can see the ingredients. So what is the ingredients in gelsemium? Active principle we call, right? Gelsemin and coumarin. There are principal active ingredients in the gelsemium, exhibit mechanical antiolodemia. Sorry, dynia. Antiolodemia, very difficult to read. Via spinal and glycine receptors activation induce allopregnanolone biosynthesis. What is it actually? So here they did in research in right rats. So what's going to happen? They inject in the active ingredients. So what happened in the nerve system? So they very clearly explain. And also another, the interesting paper I got through the Google in the Punjab University of Punjab, Chandigarh, they did a lot of research on gelsemium toxin, gelsemium ingredients. When you read, because all are in very, very, very small letters, but when you see all these things, when you read this literature, the research literature, this is not homeopathic research, but they did in toxicological research. So most of the 50% of our materia medica symptoms are here. See? So gelsemium, how it's causing it's producing symptoms like, so most of the symptoms which we are going to study later in materia medica. So 50% of the toxicological symptoms and the proving are here. They mention in the human study as well as the animal study. Then as usual, I think many of you know that whenever the patient comes, I used to refer the H.A. Roberts sensation assay. So here in this case also, I referred my favorite things, sensation assay. The same symptoms very clearly. These are all, most of the rubrics are in single remedy rubrics, right? The cloud over the outer half of the left eye. The other symptoms like mist means the cloudy appearance before the eyes. The other symptoms are outline of objects were shaded by colors. So in the center, the darkness. The outside, little colored, different kind of colored. And colored outline objects were shaded by colored, right? That's also gelsemium. Then again, the patient language, the same language. I feel always the smoke kind of things appears in front of my eyes. So smoke before the eye, again, gelsemium. Then the specs means the dark spotted, black spotted before eye, gelsemium. So like that, you can see all the, even the sensation also, right, confirm the gelsemium the patient belongs to. And the other materia medica, right, one of the important, right, the reference materia medica, encyclopedia of pure materia medica, T.F. Allen. So in gelsemium, he mentioned about dimness of vision, and the slight mist come before the eyes. On one patient comparing to a lot of smoke rising before his eyes. So like that, so he mentioned all the symptoms, the proving. So they mentioned in the materia medica. So this gelsemium drug seems to be produced two kind of diplopia. There are two kind of diplopia, double vision. The patient also has double vision, not always comes on and off. So here, the other things the patient mentions, the patient mentions the dilated pupil, not patient mentioned, when I observe on examinations, mild dilated pupil on the, especially on left eye. When I examine, I don't know whether it's both eyes, the pupil dilated all the time, but when I examine the left eye, pupil dilated. So smoky appearance before the eye, even dilated pupils. So here very cold. Outside also very cold. That's right. Okay. Then I just I want to highlight certain symptoms of gelsemium. I think most of you studied in Materia Medica. Just I want to refresh the things. So especially gelsemium, right? Always we say in Materia Medica, right? Always we remember 3 Ds. 3D, drowsiness, dizziness, dullness. Drowsiness, dizziness, dullness. So always we can remember 3 Ds. But this patient also has, right, drowsiness, dizziness, dullness. The dizziness because of, the loss of the partial vision. Not because of the other vertigo or no, there's no such a symptoms, but only the dizziness caused by this. And bursting headache. But the patient, she doesn't have that severe headache or bursting headache, but always she had the symptoms, headache symptoms on the occipital region with numbness. And when you see in the mental, right, the anticipatory anxiety, right? Why? Because of the worries happen always because of the money invested in the film industry. So both husband and wife, they invest, but more the 70% of the share from the wife side. So I know the whole story of the confusion and drowsiness, unable to control the muscles when ill, shakes, and trembles and emotion, right? That kind of things. But patient doesn't have this kind of things, but the emotionally, sorry. And the other symptoms also here in modality was, the symptom was thinking about their ailments, right? Lack of thirst, but patient, she doesn't have that's thirst. Usually thirst is there. And the paralytic condition, as I mentioned here, paralytic conditions, migraine, because in previously she had a history of stroke, right? Mild stroke. And so after 1 week, she recovered. 2 times she had a stroke. So the same symptom is there. Then the emotional tendencies are very panic, anticipatory fear, right? Then Dr. Rajan Shankaran, he mentioned gelsemium is a psychotic remedy. It belongs to the plant kingdom. Gelsemium has ailments from anticipation. So here in this case, it's especially in the bad news, always see expecting, that's called anticipatory. Actually, it's not happened, but right, expecting the bad news always. Get apprehensive in the face of ordeal. They develop a lack of self-confidence in such situations. So here the same thing happened. So what is the ordeal? In the here, yeah. Just I refer what the ordeals play a role over here in these patients. So that's a dictionary meaning itself. An ordeal is a something difficult or painful, horrific experience, right? Actually, it's not happened, but the patient, right, always thinking about, oh, this is going to happen, this is going to happen, right? Something a kind of hard, like taking a test. It's a in Tamil, and I don't know in Malayalam, the Sodhana column, right? The period of test, right? That is an ordeal, right? Because already they invested money and they are expecting, right? So this is the period of the test period, right? Testing period. But often ordeal is a serious and long-lasting, right, event, like an illness or any tragedy or any disease or kind of severe disease or cancer, whatever, right? So in Fadak Materia Medica, he mentioned about the ordeal, the effect of grief. Cannot cry, but this patient, even though during the 1 hour, the first 1 hour period of case taking, and second visit after 2 weeks, that's also 1 hour period of, but she is in the mood, but she doesn't cry, right? So cannot cry. So these symptoms which I observe. Then the rubrics, especially in Gelsemium rubrics, ailments from anticipation, ailments from bad news, ailments from excitement or emotional things, ailments from shock, mental shock. Then excitement, hearing horrible, that is ordeal, horrible things. Confidence wants to self, right? Self-confidence, it's there's a problem here. Timidity, appearing in public. But in this patient, because of the loss of vision, partial loss of vision, so she avoid the crowd. Again, I told you, dullness, sluggishness, the 3D, dullness, drowsiness, right? And what are the other 3D? Yeah, dullness, dizziness, drowsiness, right? So same thing over here. So what is it? So in when you referred the Loginaceae family, because Gelsemium is a plant remedy, belongs to Loginaceae family, you can see all the pictures that Rajan Shankaran, he described in beautiful manner in his textbook, right? Something over here, okay. So very sudden shock that caused paralysis. But in this case also, there's a infarction in the particular where the optic nerve enter. So in that area, completely, right, infarction that cause paralysis. So the other symptoms also that belongs to the Loginaceae family. Here you can see, right? And the now we have to come. We are going to discuss about why I explained in the beginning, right? What is this, right? That is very important. unleash the healing artist inside the patient. I think many of you think, why this guy, he had given this topic, right? So aphorism 26, a weaker dynamic affection. I think, you're right, we always memorize things during a organ class. A weaker dynamic affection is permanently extinguished in the living organism by stronger one. So here there are two words, weaker dynamic affection, right? Removed permanently, by a stronger one. So here, what is this? The weaker dynamic one and stronger one. So weaker dynamic affection, that is always the disease affected vital force. It's nothing but simply it's a disease affected vital force. But the stronger one is the medicinal force. So both are dynamic in nature. Both are dynamic in nature. The one produce the language of the disease, the patient side, right? One produce the language of the disease, that is the totality of symptom of the patient. The another one, it produce the language of the medicine, that is called materia medica. So here just I want to write this here, the philosophy of the behind the materia medica. There are two things, right? Drug proving, the other side the patient. So drug proving is an artificial disease. Again, the patient side the natural symptom. So that is called the portrait of the picture of the patient. That is totality of symptoms. Here the portrait, the picture of drug, that is materia medica. So just I am comparing. Why I am comparing all these things? I'll tell you. The first one, the body language of the disease, that is totality of symptom. The body language of medicine. There are two different things. One is drug proving, the other one is the artificial disease and natural disease. So as a homeopath, our duty to unleash the artist who is behind the sick individual as an actor. So each and every patient, each and every individual, when they come, right, with the hidden picture, the hidden artist, though that is our duty to find out, unlock the artist who is the right acting behind or inside this patient. So each and every actor, you know, the cine, just you can imagine the cine actors now. Each and every actor has its own characteristic mode of nature of acting, special acting, right? That's why they are very unique and individual. So for example, say Tamil, the popular, the actor, right, Rajinikanth. He has his own special, unique, right, and Mammootty. Even when they are punch dialogue and they are unique, the acting, right, and see Jackie Chan, the Will Smith, Hollywood actor, right, Amitabh Bachchan. They have their own unique. Even without seeing the movie, when if you hear the Rajinikanth dialogue or Mammootty dialogue, so immediately you can understand, right? Even some people they mimic like them, then you can understand. Oh, he's mimic Rajinikanth or Amitabh Bachchan, like that. So there's a unique style of each and every individual. That is their trademark. That is their mannerism. That is their gesture, symbol gestures, right? They are very unique, and we can instantly recognize. Oh, this pair. So like that, each and every individual, the patients we have a picture right within them. So we have to find out the picture. We have to unlock the picture, then we prescribe the remedy. There's the same thing happen in this gelsemium case. So how to unleash or reveal? So without seeing the movie, without seeing your Mammootty or Amitabh Bachchan or Rajinikanth movie, but you can't right identify. You can't identify. Oh, this is Rajinikanth punch dialogue, or this is Amitabh Bachchan style of action, or their movements and like that, right? So for that we have to watch the movie. At least few movies if you watch, then you can understand. So here our movie, what is our movie? The Materia Medica, right? So in homeopathy, we have to familiar. That's why whenever I present the case, I always teach, I always explain about different kind of Materia Medica, what they explain, how they explain in the symptoms in particular related to the remedy. So in homeopathy, how to familiar with this by studying Materia Medica, right? So the hidden nature of Materia Medica, that is in the patient, called natural disease, which is acting behind this individual, right? That is a healing artist. Each and every individual, we have a healing artist, right? So we have to find out, we have to unlock, we have to unleash. The real nature of Materia Medica is called, right? What happened when they give to the healthy individual, the proving. The same thing, it's happened over here too, right? So mainly, we have three kingdoms mainly, right? Plant, the mineral, and animal. So even when you, right, analyze the patient, taking the history, the half of the history taking, even you can, right, understand whether this guy belongs to animal or mineral or plant. This is not the unproduced, I can't call as an unproduced observer, no. But even though before they diagnose the remedy, before they select the remedy, but with a group of symptoms, you can understand, oh, he belongs to plant, he belongs to animal, he belongs to, this patient is belong to mineral, right? So what is the main identity or main the acting here, the acting, right, of plant? They are very emotional and very sensitivity and reactivity. Sensitivity and reactivity, that is the nature of plant. The acting of mineral, right, that is very strong. They are very structured and they are very communicative. And they are very calculative. Here the sensitive, they are more relationship. Why they are more relationship? Because the minerals are, right, kind of, if you see carbon, hydrogen, oxygen, all kind of things, different things, the minerals are based on their structure. So without structure, there is nothing in the mineral. But here in the animal, the main core of action is survival and competition, right? If you see the overall, right, survival and competition. So always they are victim as well as the aggressive, both sides. So this is a very interesting. See, suppose if you take one example, like relationship, the planned structure, the planned actor, the planned action is very, very emotional relationship. But in animal, they are not emotional. They are very affectionate, caring, love, all right, all related to that very affectionate relationship. And when you come, just come into the mineral relationship, they are always right dealing. They have right give and take policy. Give and take policy means with kind of bonding and the dealing, right? Mutual. They are mutual understanding. If you give, I'll give you. If you love, I'll love you. If you take revenge, I will take. Like that. That relationship is the mutual bonding relationship, right? So plant sensitive, animal competition, survival, and minerals structured. They well organized, right? Well organized, right? Systematic. Exactly. The mineral patients, when they come into you, when they reveal the symptoms, when they explain the symptoms, very, very uniquely they explain, very structured, one by one. Sometimes they make a note and they bring the right symptoms, or they explain, because already they prepared. Right? They make a note and right, oh, this is it. So like that, well organized. Even their word of the gestures and their communication and everything is perfect, orderly, right? And they mention always the period, numbers. So this doctor, this happened, you know, this exactly they use the word exactly in this time, in this period. So morning 7 o'clock. Or there, so like that, the exactness is there in the mineral patients. But in animal, always they're feeling, attention seeking. But they are in animal patient, in animal kingdom, in animal action, they are what do you call? They are the eye contact is very important. They want to seek your attention, right? When they, but these people, the plant, they are always emotional. They started crying, and even you also feel wants to cry. That kind of symptoms are there. So like that, the emotionally sensitive plant, very adaptable. The plants here, you can see outside the plants are very, now there's no leaf, nothing. There's no single leaf in the plants. But in April comes,
Yes,
slowly,
Dr. Professor Paul Joseph.
time is over.
Only 3 minutes remaining. We need
Okay. Discussion?
yes, only short discussion can possible now.
Okay. I'll wind up the session. Now, if any question, you can ask here maybe another 3 minutes. Okay. Is there any question or any
Yes,
question
really
related to the case?
definitely entering into the patient and unleashing the patient is something great to find the right medicine for the patient. As you rightly pointed out here, that the inner side of the patient is more important than what you see outside. And in order to reach the simillimum, you will have to find all the symptoms and why it comes and where it comes and how it is written in the materia medica, whether it matches with the materia medica. And you have done a great research on that way, how these medicines, when you get a medicine, right medicine seem to be the seem to be the right remedy when you
Yeah,
recognize the
after
case.
I'll conclude this one. so after 2 months, the patient, after gelsemium, I prescribed the patient, improved a lot. Then after completely 1 month, they came for a third visit. So completely, there's completely the patient back to normal. There's nothing is there. Then they said, so we are going to have the MRI again. After that, they didn't come back. So they
Yes.
went to India. They went to India, and I don't know. I didn't have a connection with them. Thank you.
Definitely. Exactly. That's what we have to look into. Finding the right remedy, and you make sure that the medicine is the right one. That's why you go ahead with reading all these repertories and what is written in all these materia medica about gelsemium, and then you make sure that you made sure that the medicine was absolutely right, and that's the reason why you got the result in such a beautiful way. Anyway, I invite Dr. Serbi from Turkey to say a word of thanks to the session.
Hi, thank you, Dr. Danish and Dr. Joseph. It's a wonderful session, and really thanks for IFPH, because every evening we learn a lot of new knowledge about homeopathy and materia medica and case. And I want to ask a question, Dr. Joseph. I have a patient, she has lung cancer and has at the same time diplopia. Side effects of chemotherapy, but really like gelsemium, and I give her, but there is no change. Do you have any idea about that? And at the same time, using phosphorus, do you have any idea about another like gelsemium, inimical or antagonist or other remedy? Thank you so much.
Okay, that because after radiation, right?
Yes.
So yeah, the
No,
cadmium.
not radiation, chemotherapy.
Yeah, chemotherapy, whatever it is. So you have to detoxify, not immediately after the treatment, but so how long it was happened? The diplopia and
2 years
radiation.
ago. 2
Pardon?
years ago. 2 years
Okay.
ago.
Okay, now you can prescribe the cadmium salt.
Cadmium, sir. Thank you
Yeah,
so
you
much.
can. Yes, you can just. Or otherwise, because this is my experience in different kind of cases after not the diplopia, maybe another kind of things after chemotherapy and radiations. Or otherwise, you have to retake the full history, and you can prescribe the totality base.
Thank you so much. Thank you,
Okay.
Dr. Joseph.
Okay.
Thank you, Danish.
Thank you. Thank you, Dr. Serbi and Dr. Paul Joseph for such a
Yeah, you unmute, please.
yes.
Okay.
Yes.
I did. I
Thank you,
mistake.
Dr. Serbi. Thank you, Dr. Serbi and Dr. Paul Joseph and those who attend the session. What a beautiful session, really indeed. And we are very happy to announce for the tomorrow session. We have a session from Dr. Marian Salcedo Rios from Bolivia. And Doctor will be talking about varicose ulceration, a case review, and materia medica. So another big day is waiting for you. You can join the same by using the same link that you used today. Thank you, Dr. Paul Joseph and others.
Thank you, dear.
It's over to Dr. Mariam Rajon to moderate the Malayalam session.